Well, sometimes they can feel very similar, but low back pain seems to be a very common phenomena. Often it's related to degree of wear and tear change in the facet joints and the discs and the base of the spine, and often you'll find that have a stiff lower back in the morning when you get up. You may have a stiff back over an extended period of standing or sitting. Pain in the middle or upper back, maybe to other different causes, still often wear and tear change, but may come on for different reasons and different positions. So sometimes it may be a muscular injury, for example, weightlifting or a certain type of exercise. It tends to be less common, although still reasonably intrusive. But principally the thing about lower back pain is often you'll find it'll get better with exercise and activity. So initially it's stiff when you get up from a chair and you carry on moving, and it will tend to get better, and that's very reassuring. Sometimes with pain in the middle or upper back, it may be some sort of recurrent injury that you're sitting in a certain position and twisting in a certain position, which makes it more difficult to alleviate. But most of them are non-sinister and will typically resolve with exercise and also time. It'll be wear and tear change, so degeneration in the disc, facet joints, arthritic type change. Also, to some extent, people having a sedentary lifestyle, so the lower back ends up being, the muscles end up being weaker. And that's where things like yoga and Pilates are very helpful in terms of building up that core strength. And it will also be sometimes repetitive strain injury. For example, weightlifters or people doing certain types of exercise will also cause muscle strain, and that will manifest itself with a degree of stiffness and pain in the lower back. Very rarely is it caused by anything sinister. Typically, it's weakness into your legs. Sometimes it's severe pain shooting down your legs. That tends to point you more towards nerve root compression. Pain that's persisted or wakes you from sleep. Although it's still, again, that may not be sinister, it can still be muscular in nature. And the critical ones are any problems with passing urine or opening your bowels. So typically incontinence, they're emergencies and people should present immediately to A&E. Typically, it's pain that sort of occurs intermittently. You can reliably reproduce it. You find it happens the same sort of time. So you have it worse in the morning, you're stiff, and then as you do exercise, it goes away. It's an often pain that resolves with exercise, stretching, and simple analgesia. They're the typical sorts. It's very common for people to have back pain. The majority of the population will experience it at some point in their life. And if someone's had a single episode of it, it's likely to have further episodes. Pain that wakes people from sleep is more of a concern, but the vast majority of these will not be something that's a sinister problem or a cause for concern. But if the pain's waking up at night, that's definitely worth having it investigated. If it occurs without any particular warning, or it's just there all the time, then I think, again, you probably suggest it needs to be investigated.